Hello students, today I am going to deal with the spotter related to the fine needle aspiration cytology. So this is one among a cytology branch and this is not like exfoliative as you've seen in the pap smear. Here we will use aspiration biopsy technique and specimen handling method. So this fine needle aspiration is widely used for evaluating palpable superficial masses and cysts as well as deep-seated non-palpable radiological abnormalities under image guidance. This aspiration techniques need list of equipments and those equipments are syringe holder, disposable sterile, fluid transport medium, local anesthesia, alcohol fixatives, commercially spray fixatives or coupling jar filled with 95% of ethanol, gloves, pen or pencil for labeling slides and plastic slide holders or slide trays for transporting slides. So these are the equipment list needed for performing the FNAC procedure. So after readying the equipment, so this is the image of equipment placed in order. So this is small, these equipments are small enough to fit into a basket and this could be quickly assembled on a small counter space area. After readying the equipment, patient should be positioned properly for the immobilizing the lesion so that the patient are ready for sampling the lesion. So readying the equipment, positioning the patient and sampling the lesion is necessary procedure for doing the fine needle aspiration cytology. So after preparing the patient and sampling the lesion, you have to prepare the sample by making smear. The smears may be prepared by using any one of the methods like one smear preparation methods. So this is the image of one smear preparation methods, and you have another method called two smear preparation method. So with using any one method, the slide is smeared and after smearing the slide should be fixed properly with alcohol fixation and stained with Romanowski's type of stain, or perpendicular stain is also standardly used for fine needle aspiration cytology, and after staining it should be airtight. Moving on to the spotter, today's spotter, and FNAC of breast pathology is the today's spotter for you, and today's class is about FNAC of fibroadenoma breast and which is one among your cytology spotter. This is one among your cytology spotter, fine needle aspiration of breast fibroadenoma. So moving on to the topic. So this is the low power view of FNAC fibroadenoma breast. Here you people could able to see the hypercellular benign duct epithelial cells arranged in sheets and clusters. This clusters is otherwise called antler horn cluster or three-dimensional cluster. So you could see in the scanner view you could see the hypercellular area, so increased cellularity. Okay, so hypercellular area arranged in antler horn cluster is one of the diagnostic clue for your fibroadenoma cytology breast. Okay, so this is the benign duct epithelial cells arranged in sheets and clusters in a three-dimensional pattern or antler horn cluster pattern. Just have a look at it. Hypercellularity with arrangement of clusters. Let me see the high power view now. So this is the high power magnification. You could able to appreciate here the cluster of duct epithelial cells having uniform nuclei and bipolar cells in the background. So in the background you could able to see the single bipolar cells or bare nuclei, that means without cytoplasm. This is called naked nuclei. This naked nuclei or bare nuclei is the characteristics of fibroadenoma breast. Okay. So cluster of cells with bare nuclei in the background. You could able to appreciate in this slide very clearly. There is many bare nuclei in the background, which is the characteristic or diagnostic findings for the benign breast tissue. This is the characteristic to exclude the malignancy of the breast also. So bare nuclei in the background with cluster of benign duct epithelial cell is the finding of your benign breast tissue, and with the type of cluster present here, antler horn cluster, you could able to say this slide is definitely a FNAC of cytology breast pathology fibroadenoma. This is the high power view of cluster of tightly cohesive cluster of benign breast duct epithelial cells with uniform nuclei. This is the descriptive point, photographic image of descriptive point, which you should write in your exam and also in your record notebook. So you have to draw this picture, and these are the points to be written in your relevant points. You should have to write sheets of benign duct epithelial cells having uniform nuclei, and there will be a presence of fibromyxoid stroma and many bare nuclei of myoepithelial cells. Okay, just remember to write benign duct epithelial cells, uniform nuclei, many bare nuclei in the background with presence of fibromyxoid stroma, and your identification. So in your exam you have to identify the slide with 2 or 3 relevant microscopic writings. Okay, thank you.